Okay, I think we'll get started now while we wait just for a few more people to filter in while we go through the housekeeping. So good afternoon, or good morning or evening, wherever you're joining us from. Many of you know me. My name is Amy Savage, and I work in the Climate Change and Health Unit, WHO headquarters here in Geneva. And I'm really pleased to welcome you to another of our technical webinars in our technical webinar series on climate change and health. Today, we'll be discussing the WHO operational framework for building climate resilient and low carbon health systems. So this is a practical tool that has been implemented by many countries for over a decade. It's just recently been updated in 2023. We republished it last year. And it really sets the foundation for a lot of climate change and health work and for a lot of the upcoming webinars in our series. So with a little bit of housekeeping before we get started in the content, you can see here on the screen that we have 2 sessions for this webinar and all the webinars in the series. We had one this morning, Geneva time at 9:30, and we have one now that you're attending at 3 p.m. So the content is repeated on both the sessions. You don't need to attend both of them. In any case, they will both be recorded, and the recordings will be shared on the WHO website. And here is the schedule of the upcoming webinars. So the next one will be on the 12th of June, and we'll be looking at developing a health national adaptation plan. You can scan the QR code or just go to the website to register for the next upcoming webinars. So in today's session, we will have simultaneous interpretation. This afternoon, it's in English, in French and Spanish, and we will have one speaker in French. So even if English is your preferred language, be ready to switch to the English channel when we have our speaker in French. So the instructions are here on the screen. You might want to set that up now if you're using the interpretation. So I'll quickly just go through what our agenda is for this afternoon. So in a moment, we'll hear from Dr. Diarmid Campbell-Lendrum, head of the Climate Change and Health Unit here at WHO, for some opening remarks. Then we'll hand over to Elena Villalobos Prats, who's the lead for country support and capacity building in the Climate Change and Health Unit, and she'll lead us through the technical content of the operational framework. We're then really lucky to have some representatives from the UAE and Cabo Verde to share their experiences with operationalizing or implementing the operational framework. And finally, we'll be able to break into some smaller groups, have some discussion on some of the specific components of the operational framework, a little bit more active engagement, and we'll feed back in the plenary and summarize and close the webinar. So I'm really pleased now to hand over to Dr. Diarmid Campbell-Lendrum for the opening remarks. Thank you.
Thanks so much, Amy, and thanks to everybody who's joined. It's a real pleasure to say a few words at the beginning of this webinar. If you're joining this webinar, then I think you're convinced, as we are, that climate change is one of the greatest health threats that we face. And just to emphasize how important we believe this to be at WHO, we're in the process of negotiating with the member states a new World Health Assembly resolution on climate change, the first since 2008. Which should hopefully, touch wood, be approved in 2 weeks at the World Health Assembly. If you follow WHO, you will also perhaps know that we have now elevated climate change and health to be the first of only 6 strategic priorities for our work for the next 5 years. And that's not just the work of the Secretariat, that is what we're proposing as the global health agenda, along with our member states and along with our partners. So we really think this is right at the center now of the global efforts on health, but also for those of you who follow the UNFCCC processes, health is also being placed very centrally within the climate change discussions as well. So this technical webinar series is really important to us because we are all about supporting our member states, supporting the countries to implement actions on the ground. And I would say that this particular webinar and the operational framework that you will hear about is probably our most important reference document. WHO has been working on climate change and health for several decades, implementing projects in the field for about 15 years now. But because climate change impacts on health in so many different ways, our initial experiences were a little bit sort of partial. We would do some work on heat stress, we'd do some work on vector-borne disease and so on. And after a few years, we were then in the position to pull all of this together to say, how do we propose one framework that can support a comprehensive approach to protecting health from climate change, and which supports universal health coverage and the work of health systems, and doesn't distract from it and set up a parallel agenda. So that's what this operational framework is all about. And as you will hear, it's recently been updated to integrate that work on resilience with the interest that is now coming through and that we are supporting, to also support health systems to be as low carbon as possible, because healthcare is a significant part of the global economy. It's a significant contributor to greenhouse gas emissions. So the recent update of this document brings that alongside the resilience component. So that's what you'll hear about over the course of the next hour and a half. You'll see that it's a structure for much of the work that we support through WHO. And my final word is that we're really interested in hearing your feedback on this. The feedback we have had from member states and from practitioners over the last almost decade now has been very, very positive indeed. But we recognize this is always going to be a work in progress. It's always going to be a partnership with people implementing on the ground. So we're very interested in your feedback and suggestions on how to support the framework or how to improve the framework over time. So with that, it's my pleasure to hand over to my colleague, Elena Villalobos Prats, to expand more on the content of the operational framework. Over to you, Elena.
Thanks so much, Diarmid, for this excellent introduction. Let me just share my screen. Sorry, let me see if I manage to put the presentation on. Doesn't seem to be the case for now. Be a little bit patient with me because my screen is blocked at the moment, so I cannot put the presentation mode, but I will do it as soon as possible. I think by the end of this module, of this training, basically what we are aiming for you to take away is a basic understanding on the uses of the WHO operational framework for building climate resilient and low carbon sustainable persistence, that you manage to basically understand the key concepts related to this operational framework, that you also understand the different pathways that WHO proposes for countries to advance in an integrated manner towards climate resilience in their health systems and reducing as much as possible the greenhouse gas emissions of their own operations, and basically understand how this operational framework can be used, because it has different building blocks, components, examples of interventions, and indicators that can be used by countries aiming to implement this. Let me see again. I don't know how I can go to the presentation because I don't know if the slide will work.
I don't think it will work. Do you want me to present your slides or?
Maybe because there is a problem with the toolbar. I cannot go to the presentation mode.
Okay, I can present. I have it open.
See? Thanks, Amy. Basically, I will stop sharing. Amy will be presenting the slides. And what we ask from you now is that you kindly open Slido. So basically, you can do that by either taking your mobile phones and scanning the code that you will see in the slide, or basically typing slido.com and what you can see in the screen, and then to be able to access the specific question. So while you do this, just I will introduce which is the question. Basically, we want to know from you how familiar you are with the operational framework. We did the same this morning, and almost half of the participants were not familiar with the operational framework, which is good, but half of them they were. So we got very useful also interventions when we broke in groups. So basically, thanks, we can see already that over 35% of the participants are not familiar with the operational framework, but a high proportion is quite familiar with it. Maybe we don't lose more time on this because probably
Okay, I think Helena might have dropped out. In the meantime, I will continue until she comes back.
sorry.
So this,
Yeah.
oh, you're back? Okay,
Yes,
go
I'm
ahead.
muted. I was muted. So basically, this is the causal pathway, which represents how from climate change, basically we get different health outcomes and outcomes at health systems and facilities level. And what you can see in that screen is that the health risk, as defined by the IPCC, is a combination between different hazards, exposure, how people, healthcare facilities, health systems, water systems are basically exposed to those hazards, and then the different vulnerability factors that, again, either systems, communities, individuals are susceptible to. These health risks can be modulated depending on the interventions that health systems implement at national level. Something that is important also to understand is that as WHO works closely with countries for them to understand which are the different health risks that they are facing, their understanding and their perception of the different health risks varies. So at the beginning, when we start working with countries, they really understand infectious diseases, everything related to vector-borne, dengue, malaria, but also waterborne diseases like cholera, diarrheal diseases. But as they get more and more familiar with climate change and health, they recognize the interlinkages between climate change and climate variability and specific health outcomes, like, for example, mental health, undernutrition, and so on. Next slide, please. Key definitions related to this guidance are related to climate resilient health systems. And as you can see there, we consider a health system to be climate resilient when it's able to anticipate, respond, cope with, recover from, and adapting to these either climate change shocks or stresses. And for us, shocks are related to anything that we understand as a extreme weather event, like flooding, cyclones, extreme rainfall, and then stresses are more related to these long-term climate change hazards like sea level rise, increase in long-term increase in temperature. When it goes to low carbon, what we define as a low carbon health system is basically the health system that is able to advance towards reducing the greenhouse gas emissions. So this is an important consideration also, even if we refer to this operational framework as low carbon, because basically it is easier to understand. When we promote this work to reduce the emissions, we don't just look to carbon, but to the broader greenhouse gas emissions. And in addition to this, we also want health systems to understand and reduce their environmental impact, for example, related to land use and water use. Next slide, please. When countries work at health system level and they are aiming to prepare these health systems to consider the risk by climate change, basically there are 4 approaches that they need to implement. Of course, this is a risk management approach, so they will have to implement that. They will have to understand which are the capacities that are related to anything related to climate change. So it is a lot about information systems. It is a lot about assessing the risk. It's a lot about also working with communities and communication. They will have to have a long-term vision in addition to this adaptive management approach. And then they will have to apply this to everything that they do at health system level, including, for example, service delivery of a specific climate-sensitive health risk. Next slide, please. As you can see here, basically, health systems are already operating. They already have specific capacities, but they are exposed to climate change and health. Again, it can be specific stresses or shocks, sudden disruptions, potential disruptions to their operations. What you can see in the middle, this diagram, is basically what we presented before, is this risk component that is composed of vulnerability factors, exposure pathways, and the specific hazards that countries will be exposed to. And basically, when health systems are confronted to climate-related shocks and stresses, they can potentially collapse if they are not ready for it. They can recover quickly under the response period to this shock or stress. They can recover to how they were before. They can recover better, or they can even transform and learn from this shock or stress. So their capacity to deal with future hazards is increased. Next slide, please. At the same time that countries need to understand their vulnerability to specific hazards posed by climate change, they are also responsible for a considerable amount of emissions. So between 4.8 and 5.2% of the global greenhouse gas emissions, meaning all sectors, are coming from the health sector. And again, this percentage varies from those most developed countries and those with less responsibility for the emissions. What you can see in the slide is a representation of the emissions from the NHS. And as you can see, lots of the emissions are coming from the supply chain. Next slide, please. This is the representation of the approach that we are promoting to reduce the emissions and from health systems and healthcare facility levels. Basically, similarly to the IPCC or to any sector trying to reduce their emissions, there are 3 different scopes. Scope 1 is related to the direct emissions from that can be controlled basically from health systems or healthcare facilities. Scope 2 are coming from indirect emissions, so mainly purchase energy. And then the 3rd scope is related also to indirect emissions and mainly looking at supply chain. So the quality of the image is not very good, but basically there you can see opportunities for health systems and facilities to reduce their own emissions in these different scopes. And again, you can see the depiction of how big the supply chain is in all this. In some cases, health systems are centralized and they have some direct control of specific interventions, for example, related to the products that they will buy at central level. In some cases, these decisions are taken at lower administrative levels. So this is an important consideration also to have when you are trying to reduce the emissions from health systems and healthcare facility level. Next slide, please. This is basically the summary representation of the WHO operational framework for building climate-resilient health system. As Diarmid mentioned, we started to work already with countries kind of 15 years ago, implementing interventions. And thanks to this work that we've been doing accompanying countries, ministries of health, we managed to understand that they needed a very practical approach for them to be able to tackle the increased health risks from climate change. So basically, we realized that speaking the health system language and using the building blocks of health systems, which are represented in the inner circle of this diagram, countries could really understand what they needed to do. So basically, we use those building blocks of health systems, and around those, we developed 10 specific components that, if implemented by health systems, will allow them to advance towards climate resilience, and since last year, with a new update of the operational framework, also advance towards reducing their greenhouse gas emissions. So you can see that we have as components climate transformative leadership and governance, climate smart health workforce, 3 components under health information systems, which are related to assessments of both health risks, emissions, and also capacity of health systems. We also have integrated risk monitoring, which is basically looking at integrating climate and weather information within current health information systems, surveillance systems of climate-sensitive health risk. We also have early warning, basically supporting countries for them to be able to even predict specific outbreaks of climate-sensitive health risk, and then also tracking emissions of greenhouse gas emissions. Research, then under essential medical products and technologies, we incorporate everything related to climate resilient and low carbon infrastructure, technologies, and supply chain. We have more detailed guidance looking at healthcare facilities level, but this is the overall approach. Under service delivery, we have 3 key components related to management of environmental determinants of health, the integration of all the information coming from health information systems to the way specific programs deliver their services. And then, of course, a very important component of it is everything related to climate-related emergency preparedness and management. Finance also is a very important priority by countries. So basically, we also have sustainable climate and health financing as a component of this operational framework. Next slide, please. Basically, we have already referred to the integration of low carbon sustainability in the operational framework that was developed in 2015. Next slide, please. This is very important because, as Diarmid mentioned, we don't want to create parallel processes. We don't want to create silo approaches. We really need to build on the foundations of health systems. We need to build on universal health coverage approaches. We need to build on the work that health systems are promoting. So basically, what we are trying to promote when working with health systems is an approach by which they basically prioritize their performance. We want to ensure quality of care for the populations health systems serve. But then as they advance in this left upper axis of this diagram, as countries get a health system that is better performing, they will have to also advance towards reducing their emissions. So what you can see here is basically putting together information on emissions in specific countries with information on their performance. And for that, we use as a proxy the Universal Health Coverage Index. Something that is not very clear here is that we also have data for climate resilient capacity of health systems on climate resilience. And basically, we can put all this data together, and depending on where countries are, for example, if you look at the right side top, when countries have high emissions and high performance, they should quickly move towards the green box on the left side. Next slide, please. Next slide. So click again. Yeah. So basically, these are the different pathways. When countries are on number one, so basically they have very low performing health system and they have very low emissions, probably they will need to increase their emissions, because if they are not performing well, probably this means that they don't have even access to key environmental services like water, sanitation, waste management, energy, or even technologies that will allow them to protect or to provide the healthcare that the population needs. So we in WHO think that the key for those countries is to prioritize resilience and advance basically towards universal health coverage, promoting, when feasible, low carbon technologies and approaches. So as countries move up on this scale, basically, ideally, they will get to net zero health systems by 2050. Next slide. Next slide. This is just an example looking at climate transformative leadership and governance. Basically, when you manage to have a look at the operational framework, you will see that is quite practical, quite simple. You will have a specific section for each of the components of the operational framework, in this case, the climate transformative leadership and governance. For each of the components, we have specific objectives. So in this case, governance, policy development, and cross-sectoral collaboration. Next slide. And under each of these objectives, you will have example of actions or interventions to be implemented to attain that objective. So in the case of climate transformative leadership and governance, we basically promote that ministries of health have specific climate change and health focal points at the minimum that are responsible of working across the different programs and basically promote these climate change and health considerations. So it's not only working with the malaria, the nutrition, the vector-borne diseases, but it's also working with the finance team, is working with the surveillance colleague, just to make sure that climate change considerations are integrated in a systematic and structured way within the Ministry of Health Operations. Of course, when possible, there should be a full team working on climate change and health. We also proposed the integration and engagement of the Ministry of Health on climate change and health processes at country level. Basically, as you know, there is a full climate change and health agenda that is mainly usually led by the Ministry of Environment at the country level. So basically, under this overall climate change agenda, there are different key policy interventions that need to be developed by the country, such as the National Adaptation Plan, the nationally determined contribution, the long-term low-emission development strategies. And what we try to ensure is that the health sector is also sitting into these very important climate change processes at national level. We also promote the integration of climate change consideration into key health sector planning processes, like national strategies, investment plans, And we also promote the development of national health component of national adaptation plans or overall strategies on climate change and health. Again, if you go to the operational framework, you will see many more interventions, example of interventions to be implemented under this component. And probably an important consideration is the examples that we provide for the Ministry of Health to also work with representatives from other sectors for them to be able to understand which are the policies that they should be promoted to protect also the health of the population. Within that, protecting health is not only the business of the Ministry of Health, but also the business of those health determining sectors like energy generation, water, sanitation, transport, urban planning, and so on. Next slide, please. I will not go into details on the case studies, but you will have the opportunity to have the slides. Under climate smart health workforce, component 2, basically the objectives refer to the capacity, meaning training and technical knowledge of the health workforce. Also very important is organizational capacity and ensuring that the health system has enough qualified health workforce to deal with this increased health risk posed by climate change. And another very important objective is related to information, awareness, and communication. Next slide, please. Example of interventions refer to developing a specific curricula, formal curricula on climate change and health, but also professional training. Next slide. And next slide. Next slide. As objectives related to component 3, we are entering then in the information, health information systems building block. Basically, we have objectives for countries to be able to assess the health risk from climate change. What basically we do through assessing or conducting a climate change and health vulnerability and adaptation assessment. Probably you already participated in the webinar we conducted a few days back on this specifically. We also promote an objective by which countries are expected to have to be able to assess where these emissions from greenhouse gas emissions are coming from. And again, there are more or less sophisticated mechanisms to do this. And again, and another one related to being able to track progress on both. Next slide, please. Integrated risk monitoring, early warning, and greenhouse gas emission tracking. Those are the objectives. I will not go into detail on any of those because I think I covered that when I introduced this specific component. This is fundamental, I would say, for countries to be able to change the way they deliver their services. Research, of course, is not only about having a research agenda at national level on climate change and health, but it's also making sure that this research and the evidence that is gathered at national, global, and regional level is basically informing the policies and interventions that countries promote. Next slide. Example of interventions, I think is clear. We already covered that. Next slide. Component 6, related to infrastructure, technologies, and supply chain. It is about changing and adapting current infrastructure, technologies, and supply chains, but it's also about promoting new technologies like telemedicine, and also about promoting environmental sustainability practices in health system operations. Next slide, please. As examples of interventions, basically a key and easy intervention to be promoted at country level with a huge impact in many low and middle income countries is basically ensuring access to renewable energy sources in healthcare facilities. This intervention is not only contributing to climate resilience in health systems and healthcare facilities, but also basically reducing the emissions at this level. Another one is basically promoting specific specifications for siting and construction of new healthcare facilities, and even promoting national standards towards climate resilient and low carbon sustainable healthcare facilities. Next. Next. This is a case study from NHS related to desflurane, and I think it's a very nice example on how a national health system managed to reduce their emissions and to even translate this into legal frameworks. Component 7 is related to the management of environmental determinants of health. Under this, we have as objectives monitoring, regulatory mechanisms, and coordinated cross-sectoral management of this. Probably regulatory mechanisms is also very important. This was raised in the webinar this morning. And basically, there are already WHO guidelines related to water quality, to waste management, to water waste, to air pollution. And those standards and those guidelines should be translated into national regulatory mechanisms if we are to protect the health of the population and how they are exposed to these environmental determinants of health. Next slide, please. As climate-informed health program, basically, we just need to ensure that when countries are aware of the interlinkages between climate change and health, when they have data, evidence coming from the research, when they have data coming from their surveillance system, this is basically used to change the way they deliver their programs and their interventions. Next slide, please. Also very important is the component related to climate-related emergency preparedness and management. And of course, this is key for policies and protocols, risk management, and community empowerment. Next. As example of interventions, we could mention, and again, these 7, 8, and 9 refer to service delivery. So this is really looking at interventions. So, and these interventions are really risk management approaches to everything that countries consider as a priority. So when their health risks are coming, for example, from changes in the quality of the water that the population are exposed to, or the quantity of the water, they can implement climate resilient water safety plans, and we have guidance for them. There is also guidance for climate resilient sanitation safety plans, and also our colleagues from the malaria department are already integrating climate and weather information into the work that they promote at country level. And that can be done, for example, just considering how specific spatial risks are present, where the hotspots are, and how they have to change their prevention and their program to just protect the population that is most exposed. And for this, we have to refer back to the exposure pathways and to the vulnerability factors that we mentioned before. Of course, vital is to have health sector contingency plans or even heat health action plans. We are seeing an increase in the prioritization that countries have, for example, for heat. So the heat, there are specific ways to basically get prepared to this increase in heat stress and the health burden that it is accompanied with. Next slide, please. Next. Finance is a very important component. Next slide. Basically, what we try for countries to do is that they manage to allocate both domestic budget, but also manage to have the capacity they need to be able to, for example, access climate change funding streams for climate change and health, such as the Green Climate Fund, the Global Environment Facility, the Adaptation Fund, and also bilateral donors, but also that specific funding stream available for development issues or for health-specific issues is also looking at the interaction between climate change and health, the intersection between climate change and health. Next slide, please. WHO can support countries to potentially access Green Climate Fund readiness funds, also adaptation funds, because we are accredited to it. So if you have any requests, please come back to us. Next slide. And basically, just to finish, there is guidance already developed trying to support countries measure progress towards climate resilient health systems. This is a priority by many countries, and there are different mechanisms by which WHO is aiming to support countries and partners coming together, basically convening those to advance everything related to indicators for climate resilience and low carbon sustainable health systems. Next slide. We have guidance for everything. As Diarmid mentioned, basically the operational framework is kind of the structure that we use for to present all the guidance and all the interventions that countries have to implement, and we develop a specific guidance for each of these components. Next slide. This is it. Thanks so much.
Thanks so much, Elena. Now we have a really comprehensive overview of the framework. We'll be able to hear from a couple of countries on their implementation of the framework. So I'm really pleased to welcome Dr. Nada El Marzouqi from the United Arab Emirates, from the Ministry of Health and Prevention. And I'll just stop sharing my screen so Dr. Nada or Saleh can share.
Hello.
You have
Good
a bit of
morning
an echo. Maybe it's
good
okay now.
afternoon and good evening for all of you. I have a problem on sharing. If you can share from, yeah, thank you very much. So thank you, Amy, and thank you, Dr. Elena, for giving us a comprehensive overview on the framework. And I'll be happy to share the United Arab Emirates Ministry of Health and Prevention experience in using this framework to plan the National Health Adaptation Plan and Framework for Action. Next, please. So we can see here the major milestones that the Ministry of Health had achieved in working on climate change and health. We had committed in COP26 back in UK to develop a climate resilient health sector along with low carbon emissions, and joined the Alliance for Transformative Action on Climate and Health group to share the experiences and mitigate the risk of climate change and health. We are closely collaborating with the Ministry of Climate Change and Environment on environmental climate change actions. And we have a health sector adaptation and mitigation actions coordination. And we cannot forget the victorious moment that we had a dedicated health day at COP28 in Dubai, and has resulted in COP28 health declaration with more than 140, around 149 countries signing to this declaration, committed to increase their capacity and increase their resilience to climate and health. Next. The Ministry of Health has worked on a framework, a national framework for action on climate change and health back in 2019. We had conducted a national climate risk assessment for the health sector, and then the national framework for action on climate change and health was developed, and this was in partnership with the WHO, and it was implemented on a national level. This was done in collaboration with multi-stakeholders, mainly with the Ministry of Climate Change and Environment for the actions needed. We had announced the commitments of the UAE to build a climate resilient and environmentally sustainable low carbon health system as part of COP26 health program. And we are co-convening and co-leading ATTACH as COP28 host in the last period of 2021 to 2023 and still on. And in collaboration with WHO and all entities in the health and environmental sector, we had conducted a national workshop focused on conducting climate change and health vulnerability and adaptation assessment, and to develop a health sector specific national adaptation plan in 2023 as part of the national adaptation plan in general. Next. We had depended on the operational framework for building climate resilient and low carbon health systems on the 6 blocks and the 10 components to update our national framework. The national workshops included a specific sessions and group work to best incorporate this operational framework into the UAE context. And the objective was to develop a specific guiding adaptation and mitigation interventions for the health system, targeting all of its components. Next, please. Using the operational framework as a guiding reference, we had an initial disc review of climate hazards and health outcomes, the national priorities and visions, and have developed a framework for actions for healthcare sector adaptation to climate change was drafted. This framework is the starting point for more comprehensive work to come and elaboration on priority areas of work on climate change within the health sector and health determining sectors. The framework also listed a number of priority actions to implement at each of the components of the health system. Next, please. Here we can see some examples related to the health information systems and health research funding and agenda. We are aiming to allocate a specific climate health research resources to have studies on local climate impacts and effective adaptation measures, support research to be translated to innovative healthcare technologies that can withstand extreme weather conditions, and to conduct the long-term studies to track the health impacts of climate change and adapt strategies accordingly, to develop an early warning and response system for healthcare facilities and communities about extreme weather, specifically on heat waves and dust storms, to conduct regular assessments to identify the vulnerable populations and regions of higher risk of climate-related health problems, and establish data sharing agreements between the health and environmental agencies to improve our risk assessments, as well as interventions needed to protect the community. Next. So very important lessons that we took from our experience is to engage the multiple stakeholders. It's very important to have everybody on board because the framework have a guidance on a wide range of interventions and requires several responsible authorities and stakeholders. So early engagement of all is something to consider. We need to adapt to our needs and your own needs. Make sure that the actions and plans align with your national vision. And this is the key for a successful implementation, since lots of the interventions will be conducted with several health and non-health sectors. And back in UAE, our next step is to expand more on the assessment of climate change impacts on population health and health system to better shape the national adaptation strategy, and at the same time implement a number of priority actions and have a win-win cases both for health and environment. Thank you.
Thanks so much, Dr. Marzouqi. This is very, very interesting and useful to see how the operational framework is being implemented in the United Arab Emirates. And I'm very pleased now to welcome Dr. Maria da Luz Lima from Cabo Verde. Dr. Maria, can I just ask if you would prefer that I share your presentation from my side?
Oui,
Okay, and just to let everyone
non,
know,
est-ce que je vais essayer de faire
oh, you try? Okay,
ça,
just
mais il faut faire l'autorisation pour que je puisse faire
I
le...
can add you as co-host.
Non,
Vous
on va avancer,
pouvez,
pas de problème. Non, non,
vous pouvez essayer maintenant ou...
ah, ok, c'est bon.
Ok,
Oui, oui, merci, c'est bon. Merci, bonjour, bonsoir à tous et merci de l'invitation pour faire cette présentation du cadre opérationnel de l'OMS pour l'élaboration de PNAS 2023-2027 du Cap-Vert. Je suis Maria da Luz Lima. Je suis la directrice de l'Institut national de santé publique et aussi le point focal de le ministère de la Santé par rapport au changement climatique. Et cette présentation, j'ai fait avec Madame Edith Pereira. Il travaille au Bureau national de l'OMS. Et je veux profiter de cette occasion pour remercier à l'OMS local et même à l'OMS Afrique et l'OMS Genève pour tout l'appui qu'on a donné au Cap-Vert par rapport à l'élaboration du plan national de changement climatique, adaptation de santé au changement climatique. Bon, je vais faire une petite présentation de mon pays. Elle s'appelle Cap-Vert. Cap-Vert. C'est un petit État insulaire. C'est un archipel de 2 îles dans 900 habités. Et la population, c'est moins de 500 000 habitants. Et il a une île de Santiago, qui est la plus grande dans le pays et qui concentre la moitié de la population et la capitale qui est à Praia. Au niveau démographique et épidémiologique, le pays est en phase de transition démographique, épidémiologique. L'espérance de vie à la naissance, c'est 73 ans. Et vous laissez le pyramide étage terre, c'est justement maintenant en train de horizontaliser là-bas, mais on voit qu'il y a beaucoup de jeunesse ici au Cap-Vert. C'est un pays qui est la localisation géographique est au niveau de l'Afrique de l'Ouest, ici dans cette couche. Et elle est dans l'espace géopolitique et la communauté économique des États des Afriques de l'Est et de la communauté des pays de langue portugaise. Parce que le Cap-Verde, c'est un des 5 pays africains qui parlent comme langue portugaise comme la langue officielle. C'est pour ça quelques difficultés que j'ai en parlant le français, mais j'espère que vous entendez. Bon, le climat, c'est tropical sec, c'est un pays basiquement touristique. Il y a beaucoup d'activités économiques. Bon, comme un petit État insulaire en développement, le Cap-Vert, les phénomènes, comme est le cas du Cap-Vert, les phénomènes extrêmes tels que l'augmentation de la fréquence des sécheresses, l'aggravation de l'intrusion saline, la détérioration des eaux souterraines, la dégradation des sols et la perte de biodiversité, l'augmentation de la fréquence des tempêtes sont déjà observés. Et ça, c'est un problème très important pour nous parce que les projections futures prouvent que la température moyenne annuelle de la planète augmentera 0,7% de 2,5 degrés, comme vous savez, d'ici à 2660. Bon, les très engagés, même par rapport à le committement de la conférence des parties en 2021 et on a fait la validation du plan national d'adaptation au changement climatique. Et après, il y a beaucoup ici, vous pouvez voir les principaux engagements pris par les gouvernements du Cap-Vert à la 36e conférence des parties unies des Nations Unies, comme la ratification du protocole de Kyoto, l'adoption de la résolution cadre opérationnelle pour l'adaptation de la santé publique au changement climatique, la ratification de l'accord du Paris et l'élaboration et la mise en œuvre d'un plan d'action national pour l'adaptation au changement climatique. Nous avons déjà le comité du gouvernement du Cap-Vert par rapport à la réalisation d'une évaluation de référence des émissions de gaz d'effet de serre dans les principales installations de services de santé. Et dans cette année, nous sommes en train d'élaborer déjà un note conceptuelle pour faire ce travail. Ici, vous pouvez voir que le plan national d'adaptation du secteur de la santé au changement climatique est déjà élaboré et fini et nous sommes en train de faire l'implémentation et c'était une priorité, et surtout par rapport à l'approche universelle santé. Et au Cap-Vert, nous avons déjà élaboré aussi la stratégie pour le développement d'un système de santé écologiquement soutenable. Bon, l'importance des cadres opérationnels de l'OMS. Tous les plans qu'on a élaborés, surtout le plan national d'adaptation de santé au changement climatique, est utilisé par le cadre opérationnel pour l'orientation. Parce que c'est important que les pays soient alignés à les orientations de l'OMS, mais aussi à l'objectif de développement durable. C'est pour ça que chacun des 10 éléments qu'Elena a déjà présentés, ont été analysés et adaptés à réalité capverdienne. C'est pour ça que le cadre opérationnel était un outil très utile, car il a permis de réaliser une analyse précise et bien structurée de la résilience des systèmes de santé face au changement climatique. Et on fait aussi la priorisation des activités qu'on doit implémenter d'ici à 2027. Pour ce travail, on a beaucoup le support de l'OMS, mais aussi beaucoup de partenaires, surtout par rapport à l'approche universelle santé. On était au Cap-Vert, une consultation qui a fait un travail très collaboratif et participatif. Dans les méthodologies de travail, on peut dire, par exemple, l'analyse documentaire, discussion de groupe pour chaque composant de cadre opérationnel. C'était même un travail très participatif et très éthique et rigoureux aussi, pour qu'on puisse aligner tous les objectifs à la réalité du pays. Mais il y a, comme tous les autres plans aussi, des difficultés de l'utilisation parce que il n'y a pas beaucoup d'informations sur différents components. Ça, c'est une conclusion du plan et nous sommes en train de travailler maintenant avec tous les secteurs et les entités qui sont très importantes, un important travail par rapport à l'adaptation des changements climatiques. Ici, à droite, on peut voir les 10 components du cadre sont ici en portugais, parce que dans le plan, ils sont en portugais, parce que nous parlons portugais, mais ils reflètent toujours le cadre opérationnel de l'OMS. Bon, pour finaliser, pardon, il y a beaucoup de recommandations, mais aussi des défis qu'on a par rapport, on veut travailler dans 2024 et 2025, élaborer un plan solide et faire des autres activités qui sont dans les plans. Mais je pense que pour nous, pour notre expérience, c'était très bonne l'utilisation du cadre opérationnel de l'OMS pour faire notre plan d'action. Je pense que les pays doivent élaborer son plan dans le cadre opérationnel parce qu'il est possible d'avoir une analyse très profonde des conditions qu'on a et après adapter les plans en réalité de notre pays pour qu'on puisse répondre à tous les défis qui sont en train de que les pays font face dans la question du changement climatique. Et merci de votre attention. Muito obrigada pela vossa atenção.
Merci beaucoup, Dr. Maria de la Luz Lima. That was really interesting to hear about how the operational framework has been used in the Cabo Verde context and helping to develop the Health National Adaptation Plan. So now that we've heard from our three speakers, we know a little bit more about the operational framework. We have an opportunity to think about how we might apply that in our context. So I'll just quickly share my screen. We now will be breaking into small group discussions, and I have them on this slide here. If I can just start okay. So you'll see that there's 4 rooms. Now the interpretation only works in the main room. It doesn't work in the breakout rooms. So if you need the French or the Spanish interpretation, please stay here in the main room and don't go to another breakout room. So we'll be discussing 3 components here in the main room. But then we have 3 breakout rooms, which will all just be in English. So have a look at the components that we'll be discussing in each of the rooms. There'll be a facilitator and we'll be using the Google Jamboard. So we hope we can have a little bit more engagement and discussion. Choose which one you're most interested in. And my colleague Ichi will now open up the breakout rooms and we can all select which one we'd like to join and start to have a little bit more discussion. I think most of us are back in the main room. Elena and Elena, you finished your discussions? Okay, great. I'll hand over to Elena then to moderate the feedback session.
Thank you very much, Amy. With this session, basically, we want to hear from all of the rooms. And we hope that the rapporteurs will manage to summarize the richness of the discussions that they were involved in and basically give us a 1-minute summary of what was discussed in these rooms. So maybe we start with Lena in our own group.
Sorry, Elena, you're muted, so we lost the last part of your sentence.
Please go ahead with your summary.
Sounds good. Thank you, Elena. So in the group that was discussing service delivery components, several interesting interventions were suggested. So in the component about management of environmental determinants of health, there was a discussion about monitoring of climate-sensitive environmental risks and health outcomes. So some participants have given examples from their countries, such as Ecuador, where it is a priority to integrate climate-related variables into existing surveillance systems. And also in other settings, participants have emphasized the integration of health and climate data on a unified platform to monitor health outcomes. In terms of climate-informed health programs, this is so another component of the framework. The preparedness has been emphasized as a priority, so being prepared for possible impacts that may happen and detailed preparedness. So be ready for impacts such as difficult access to treatments and vaccines during extreme weather events, and so have updated protocols that take these risks into account. And also other interventions were mentioned, such as promoting renewable energy. And finally, in terms of emergency preparedness and management, so there was kind of some overlap with climate-informed health programs, but participants detailed a little bit more what can be done. So in terms of preparedness and response plans at local, regional, and national levels, and also being prepared for specific climate risks such as heat waves and other risks, and being able to continue health sector activities during climate emergencies as well. So that's it for me. Over to you, Elena. Thank
So
you.
much, Elena. May I invite now Dr. Hossain to kindly provide the summary from his group?
Thank you so much. We had a
Dr.
very rich discussion.
Hossain.
May I continue, please? Hello.
Yes, please go ahead.
Oh yeah, thank you. Yes, we have a very rich and very short and very rich discussion regarding how we would be able to create a transformative leadership on climate change. So we discussed about having a climate separate climate change unit for in the Ministry of Health. Then we have said that there will be a cross-sectional commitment between all the agencies and the ministries to actually contribute to the implementation of National Adaptation Plan and the National Adaptation Plan, as well as integration of the all health issues in the climate change. And we have also discussed about how the different countries are approaching. I talked from my country, Bangladesh. Then there was a discussion from Kenya, from Brazil, as well as Canada, and how different systems are trying to integrate climate change and health into that system. And also we were trying to figure it out how we could actually breach different components of the climate change, including the capacity building, as well as creating leadership and decision-making personnel in the government as well as in the agencies regarding to tackle the impacts of climate change. And
Dr. Hossain, I think we lost you. I don't know if the others are also.
it was I think that's how we discussed it. It was a pretty small time. I think we could have discussed a lot more. I think hopefully in future we will have more discussion on it. Thank you. I thank all my participants for that excellent engagement and giving us the wonderful views, feedbacks, everything. And that is how we come. Thank you so much.
Thanks to you, Dr. Hossain, just for helping us to report back on the richness of the discussions that you held. May I invite Dr. Rocco Kim to go next, please?
Hello. Okay, can you hear me? Yeah.
Yeah, we can hear you, Rocco.
Hi, everyone. Yeah. Hi. In the breakout session for essential medicine products and technologies, which is about climate resilience and low carbon infrastructures, technologies, and supply chain, the group was facilitated by Dr. Carlos Corbalan. And basically, we collected the ideas on the three areas: infrastructures, technologies, and supply chain. Basically, for infrastructure, the idea of making the infrastructure more energy efficient and carbon neutral, like solarization, and also adopting renewable energy, other renewable energies, and maximizing energy efficiency. Also, for many low and middle income countries, health infrastructure is very fragile or located in a very vulnerable area. So relocating, innovating, rebuilding, making infrastructures resilient to any extreme weather events were mentioned. This was a very important area for the many low-income countries. And for technologies, yeah, also, as mentioned, adopting high energy efficient technologies, also adopting kind of a procurement policy at the facility level and also at the national level to review the carbon footprint of technologies were mentioned. Same with the supply chain. Supply chain is actually major determinant of emissions from health sector. So there should be a national level or a site level procurement policy to review all carbon footprint of supplies, especially when the supplies are coming from out of countries. We also reviewed how this component is related to other components. And of course, number one, leadership and governance is critical to improve this component. And also financing is crucial. Without financing, particularly for the infrastructure, which costs a lot, nothing and not much can be made in this component. Also, we noted this component is related to service delivery part, particularly emergency management with infrastructure, and also a lot of environmental determinants of health, particularly water and sanitation, air pollution related to healthcare facilities. Over. Thank you.
Thanks so much, Rocco, for this comprehensive summary. Last but not least, may I invite Scott Brady to basically report back on the discussions from your group?
Yeah, thanks, Elena. I'll be super quick because I need to run off for another meeting. So in terms of the actions that we were looking to prioritize in countries, so we're looking at assessment of climate and health risks and greenhouse gas emissions. Some of the things that jumped out there was around identifying available data sources for both climate projections and the health risks associated with that. Also looking at things like guidance on where emissions data can be acquired and the techniques that are available to actually quantify that, particularly at the larger scale when we think of the national level assessments of greenhouse gas emissions. But then also factoring in other things that we maybe don't can directly associate with emissions and so on. And so thinking around inclusions of analysis on water efficiency use and so on within healthcare facilities. When we looked at integrating risks and monitoring early warning and emissions tracking, the key thing that came out there was around carbon emissions tracking, assessment and evaluation. So how do we keep that regular checking going on? It's not just a measure it once and get on with business. We need to measure the performance as we go along. The final component there is component 5, so around health and climate research. So the vulnerability and adaptations assessments and the broader HMAP process, they were identified as some of the priority elements within the countries. And yeah, and bear with me, I'm just reading a very small print one here. So there's things around promoting a toolbox, if you like, of resources and funding that might be available for health and climate research, whether for academic institutions and perhaps ministries of health and so on as well. When we moved on to the second part of this, we're looking at some of the challenges that might be faced in implementing these actions. We're looking particularly around access to relevant skills and expertise. It very much varies significantly depending what region of the world you're in, whether or not you've got access to the right consultants, or whether that's the in-house expertise and staff that are trained in these things and so on. When we start to look at some of those integrated risks and early warnings and so on, we're looking at around challenges around collection of data, the structures and so on that might be in place for implementing some of these things. And yeah, collection of data, the availability of data as well at different scales of region and time resolution. So the granularity of the data, I guess, is really what we're getting at there in terms of geographic scale and time resolution and so on. And then, yeah, we didn't get on to the third slide there around the interrelationship. That was being explained as we came back through, so we've not got anything there, I'm afraid.
Thank you very much, Scott. I think you provided a very comprehensive summary, which we really appreciate. I think we are a little bit behind, so I will skip the summary. Probably just to thank you from my side for the richfulness of your contributions. Feel free to go through the operational framework. My colleague Ichi has already shared the link at the beginning of the meeting. Get familiar with it, go through the different examples, and I think you will be the best place to understand which are the key interventions and potential indicators that should be promoted in your specific context. With this, I just would like to thank the whole team, Amy, Carlos, Antoni, Sichi, for the work behind the scenes and all the technical work that goes with it. And then just I hand over to Amy.
Thanks, Elena. And we are over time, so I'll be super quick. First, of course, a very, very big thank you to all the speakers today. The speakers from UAE, from Cabo Verde, and Elena, of course. And a quick reminder, which I'll just share on my screen. This is, of course, part of a webinar series. And the next webinar is on the 12th of June, looking at developing a health national adaptation plan. And it will be a really good follow-on from this current webinar, because we will be looking at how we can use the operational framework to structure and frame a health national adaptation plan. We do have one final Slido. Of course, we are running over time. It's the same place as before. So we will leave it open for a little while. So please feel free to just log on and leave your responses here. We're just wondering how you plan to apply the operational framework in your work, and if there's any kind of support that you need, further support to apply it in your context. But mostly, I would like to thank all of you for your engagement, your participation, and we look forward to seeing you at a future webinar. And thank you very much. Have a great day, evening, wherever you are. Thank you very much.
Thank you.